everyone, my name is Abby Morningstar. I'm a registered dietitian with Clemson Rural Health. Today we're going to be talking all about the 7 strategies to cope and manage your type 2 diabetes. If any of the things we talk about seem unfamiliar to you, feel free to check out all of our other videos as we go more in depth into each one of these topics. So in summary, there are 7 ways to manage diabetes in the most healthy way. The first one being to eat healthy. We have many videos talking about following the plate method, starchy versus non-starchy vegetables, how to get your protein in, everything like that. But eating healthy is one of the best ways to manage your diabetes. The second strategy is to set realistic goals for yourself. Again, we have a video all about following our SMART goals, but realistically setting attainable goals for you to follow, and that way you can measure your progress in a specific and attainable way. The third strategy is monitoring routinely. So this is something you can talk to your primary care provider about, or your diabetic educator, or even your dietitian. But this is about managing and checking your blood sugar, looking at your insulin regimen, and just making sure all your numbers are in target. If you have any questions about what your numbers should be, please consult with your primary care provider. The fourth strategy is problem solving appropriately. So what we mean by problem solving is if you have a low blood sugar that's been running low throughout the whole day, what are some ways that we can get it back up in your target range and sustain it? Maybe it's eating something with some carbohydrates and some protein. Maybe it's calling your primary care provider to discuss your medications. But problem solving around your diabetes is a great way to help manage this the best way you can. The fifth strategy is to reduce risks. What this means is making sure you are taking your medications as prescribed, exercising in a healthy and safe way, eating the best things that we can, all to reduce our risks of the consequences of type 2 diabetes, such as impairing our eyesight, possible amputations, things like that, kidney disease. Those are all things we don't want to do. And if we use these strategies to manage our type 2 diabetes, we can keep it well within normal range. The sixth strategy is staying active. I just mentioned this earlier, but staying active and participating in some sort of physical activity or movement that you enjoy is a great way to keep your type 2 diabetes manageable. We have another video that talks more in depth about physical activity, the recommendations, and different types, so feel free to check that out. The seventh and final strategy is taking your medications. I've touched on that a lot in this video, but taking our medications as prescribed and having conversations with your primary care provider about your medication regimen is key to effectively managing your type 2 diabetes to the best of both you and your primary care provider's ability. So in summary, those are the strategies to help manage your diabetes both healthfully and safely. Feel free to check out any of our other videos as we dive more into this. Thanks.